We're all set?
Yeah, we are set. Yes.
Okay, fantastic. My name is Elizabeth Yuko. My pronouns are she, her. I am a bioethicist and journalist, and I've been living with long COVID since April of 2020. I started covering COVID for Rolling Stone in February of 2020, and I haven't stopped. I've been reporting on long COVID specifically since June of 2020, before we really had a name. And like so many others with long COVID, the virus left me with a different brain and a different body, and I'm still grieving my former self. And even after 5 years, it's hard recognizing myself. And I'm sure a lot of people can relate to that. Um, when I first started reporting on long COVID, that was back when we were told in no uncertain terms that COVID ended in one of two ways. Either it lasted 2 weeks and then you were fine, or you died. But millions of us are not fine and we're not dead. We're existing in an in-between state where we're grieving our former lives, bodies, and brains, and have to make do with what we have now. We also exist in a country that has never really acknowledged us to begin with, and are now living under a regime that is actively trying to erase us, no matter what kind of meetings they hold. So far, we haven't seen anything that's really helping us. Through my reporting, I've had the opportunity to meet and speak with countless people living with long COVID. Some have lost their jobs because they were no longer able to keep up with work. Some have lost their personality and watched them turn into someone they didn't recognize. Many saw marriages and other relationships end. Thousands of people died because of long COVID, and the death toll is growing. Capitalism, which is the closest thing the current president has to religion or a set of beliefs, wasn't designed with people with disabilities or chronic illnesses in mind. We have to fight for our accommodations that aren't granted. We have to get creative to make ends meet. Resilience is praised as the ultimate virtue, but in reality, telling people to be resilient is essentially telling them to suck it up and get on with their lives. And we've had to be even more resilient since Trump took office and brought Robert F. Kennedy Jr. along with him. The constant attacks on healthcare, science, research, and reason have left us more vulnerable than ever. So far, RFK Jr. has had no problem making empty promises about long COVID, but it has yet to be seen whether he'll follow through with anything. What is heartening is how many people have turned out today. We need to take this moment and mobilize to the extent that people with chronic illnesses can mobilize, and send the message that we're not going anywhere and we need a solution to long COVID now. Where's my little list? Let me just reopen it. Oh, there it is. We are going to start with our first speaker, which is Dr. MarkAlain Dery, an epidemiologist. Mark.
Great. Thank you so very much. It's such a pleasure to be here. And I do have a couple words to say on this great day. My name is MarkAlain Dery. I'm an infectious diseases physician and public health advocate and practitioner based here in New Orleans, Louisiana. But today I speak not as a partisan figure, but as a clinician who bears witness to how funding decisions ripple through clinics, through laboratories, through hospitals, through homes, and through our communities. Our public health system is literally a living, breathing organism. It thrives on steady support, rigorous surveillance, and clear science-based communication. When those foundations wobble, people, patients, you, me, we pay the price. Often in hard to treat infections, in delayed responses, and crowded clinics. And our goal today is to name what's at stake, and that's essentially to connect those dots between policy and patient care and commit to concrete action that protects our communities. So, what are we talking about? Across federal, state, and local levels, funding for public health programs, surveillance, outbreak response, laboratory capacity, and cross-border health security has shifted and in many cases has diminished. These changes aren't abstract budget lines. They translate into slower detection of emerging threats, fewer trained epidemiologists on call, and delays in deploying diagnostics and countermeasures during outbreaks. When funds are redirected away from core public health infrastructure, the result is less resilience in the face of infectious threats. We see more time to identify novel pathogens, more time to confirm cases, and more time before protective actions actually reach people who actually need them the most. This is not theoretical at all. It's the difference between early containment and broad community transmission. So disasters don't respect borders, and neither do viruses for that matter. And neither should our surveillance system respect borders as well, because gaps in flu surveillance, zoonotic monitoring, and environmental health data leave us playing catch up rather than prevention. So really a robust One Health approach, which integrates human, animal, and environmental health, requires essentially sustained investment in data systems, labs, and workforce training. And we've seen how surveillance gaps conceal signals of outbreaks such as bird flu, avian influenza, and other novel pathogens before they become widespread. And when those early warning networks weaken, responses lag, and the consequences ripple into homes and clinics and workplaces. The message is clear. Sustaining readiness today minimizes the damage tomorrow. Measles is a blunt reminder of what happens when vaccination programs are undermined by misinformation, access barriers, or policy shifts that reduce outreach and coverage. The measles outbreak that we've seen recently, we've seen strain on pediatric and family clinics, disruption in school attendance, and the threatening of vulnerable populations, infants, pregnant people, and immunocompromised individuals who rely on herd immunity. Vaccination programs are not merely personal choices, they're social goods that protect communities. When coverage declines, the clock resets and outbreaks reoccur. This is why durable, evidence-based immunization policies paired with transparent communication are essential to safeguarding population health. The public discourse on public health must be anchored in data and clinical experience. When policy claims lack supporting evidence or rely on misinformation, trust erodes and delay cost lives. As clinicians, our responsibility is to present clear, honest, and compassionate explanations of risks, benefits, and uncertainties, to acknowledge what remains unknown while championing the best available science. So the cost of misleading narratives extend beyond individual beliefs. They shape funding decisions, they affect staffing, and influence the speed and scope of public health interventions. So we must uphold scientific integrity and communicate with empathy and center equity in our messaging and policy advocacy. So what we need are sustained, adequately funded surveillance networks, rapid diagnostic capacity, resilient public health infrastructure, all that can weather multiple crises, whether seasonal outbreaks, emerging pathogens, or natural disasters. We must demand transparency and reporting accountability for policymakers and partnerships across healthcare, public health, and community organizations. So my specific calls to action include restore and protect core funding for national and local public health surveillance and workforce training. We need to invest in One Health initiatives that connect animal, environmental, and human health data. We need to strengthen vaccine programs with strong outreach, clear science-based messaging, and equitable access. We need to support independent, evidence-based communications that counter misinformation without shaming or stigmatizing communities. For me, I hold many Ryan White federal dollars. Ryan White is the funds that ensure that people living with HIV get free access to health care and to their antiretrovirals. We need to ensure that Ryan White and other essential care programs, not just limited to HIV, but I'm an HIV doctor, remain funded, because right now my funds are seriously, very likely are going to be cut at the end of December. We need to protect these funds so that people living with HIV and other illnesses receive continuous, free, and high quality care. The health of our communities depends on choices that are made today as clinicians, as public health professionals, and as you guys, our neighbors and our community. We owe it to our patients to advocate for systems that are data-driven, transparent, and equitable inevitable. So let us all commit to defending infrastructure that safeguards us all, surveillance, preparedness, vaccination, and compassionate care, so that when the next threat arrives, our response is swift, scientifically grounded, and people-centered, because together we can turn concern into action and protect the health of every community member. Thank you guys so much for having me. It's been a pleasure and true honor.
Thank you so much, Dr. Dery. You brought up some really great points, especially about strengthening vaccination programs, which has been such a challenge under the current administration, which has been rolling back vaccination programs. And also combating misinformation is great instead of an administration that actively promotes misinformation. And yeah, that's really not what we need right now. So our next speaker is Hartzell Gray. He is a candidate for the U.S. House of Representatives, Missouri District 4. Welcome.
Thank you all so much for having me. Can you hear me okay?
Yes.
Fantastic. Well, brothers and sisters, everyone across the binary, I'm honored. It's a privilege and a pleasure to be on this call and to be in community with you all. My name is Hartzell Gray. I'm born and raised here in Kansas City, Missouri, and I am running for Missouri's 4th district. We're going to flip the seat. Currently, it's held by a Republican who is anti-science and devoid of any sort of common sense or truth. So we're going to not just flip the seat, we are going to make sure that we have the majority in 2026. And today, I am reminded, I am encouraged of all of our folks all across the country, all across the world who have stood together in solidarity on this No Kings Day. And I want to make sure that, at least for myself personally, when I'm grounding myself in this day, it's not just no kings, as in no authoritarian, no dictator and Trump, no wannabe strongman. It is for me also a day of liberation. It is a day that we're reminded of our struggle, because yes, there is a wannabe dictator in the White House, but he is being supported and propped up by a corrupt and a corrupt and incompetent cabinet, but he's also being propped up by big moneyed interests and corporate elite. So one of the reasons why I am running for this office is because I want to take down that corporate greed that has so already commodified every bit of our life. And especially one of my major proponents and platforms is universal health care, because everyone deserves the right to be a human and to live, the freedom to live. And so when I talk about universal health care, you know, when Trump and these goons and the Republicans, when they kick off 17 of our brothers and sisters and neighbors off of their health care, not only are they sentencing our folks, our working class folks, to death, because that is what this is, but it's also being done so that it can prop up the profits and the bottom line of private entities who would buy up and privatize our rural hospitals or our clinics. They would make it so that they would rather tear down those hospitals so they can open up a clinic, because then they can charge you for the life flight, since it's going to take you an hour and a half to get to the hospital you need. And this is all intertwined with every issue we can think of, from climate to healthcare. Because climate, let's say when they want to take away all of our subsidies to make our environment sustain so that our kids and grandkids and us can have a climate that's going to be around for a while, when they take away those subsidies for us to go green, guess who makes those profits? It's the fossil fuel industries at our expense. It is profit over people. And you can hear my example. You can insert that for literally everything about our lives. Housing, again, healthcare. So I'm running because we deserve it all, every single one of us. And I have been in community with so many of folks who are on this call. We all deserve the best and the most. We were told that we were expendable. We were told that we were just cogs in the machine, and they didn't give a damn about us. They told us to go back to work, didn't tell us how, didn't tell us what we're supposed to do, but we had to make somebody money. And I'm saying that we need to make our people whole. And so that is why I'm running for this office. And we have an incredible lineup of speakers, so I don't want to take up too much time. But again, I am running because we got us. Those who are closest to the problem are not just closest to the solution. That's the thing we say in the organizing space, but we are the solution. And so, again, thank you all so much for having me. If I can close with a quote for us, I think, especially on this day that I think is bringing us so much hope and so much solidarity, I'm reminded of a quote from a certain princess who would grow up to become general of the resistance. I'm talking about Princess Leia Organa Solo Skywalker, Star Wars guy. And so Leia says this thing on hope that has shook me to my core. She said that hope is like the sun. If you only believe in it, when you see it, you'll never make it through the night. And right here on this call, we got 245 plus folks who believe that there is hope in the house tonight, yesterday, tomorrow, and all the days. We are 10 toes down in the trenches, or however we are in this fight. No matter what that barrier of entry is, we're going to find a way together to break that down, and we build up this system that's rooted in the people, rooted in making us whole and taking care of us. So again, my friends, I appreciate you. Thank you, thank you, thank you. I believe, I know that we will win. Thank you so much.
Thank you so much, Hartzell. That was a wonderful message and a good reminder that a lot of us are voting in November. And even if they're local elections, even if you wouldn't typically turn out, it is so important to vote locally, to vote on every level, really, because we're not going to get rid of this administration by waiting for the next general election. We have to chip away at it this entire time. So,
and if I can, just real quick, we have such a monumental moment. This seat, which is going to grab national attention, it already has. I'm not kidding when I say we will flip this seat and the world will change, because that means that something is happening. We're going to pull off the biggest upset in this state, and what I'm going to do is not go on TV and brag or pretend to be the press agent of the president, which is what currently Mark Alford in my seat is doing. What I'm going to do is, the first thing is, I'm going to sign on for universal health care. We're going to make sure that we pass the Block the Bombs Act so that we can invest that money, instead of a genocide, let's invest that money into treatments, into healthcare, into housing, into transportation. All these things we can do. And I know today is a reminder how much we can do it. And I can't wait to see what else we can do.
Thank you so much. That was really inspiring. And yes, everyone put it on your calendar. Don't forget to vote. So our next speaker is Nathan Luna. And Nathan, if you wouldn't mind introducing yourself briefly and sharing your pronouns.
Hi, friends. My name is Nathan Luna. I'm a 33-year-old queer man. I use he, him pronouns. I'm living with long COVID in rural Tennessee. I've performed activism in various spaces over the years. Yeah, thank you so much for having me. And thank you, Amanda, for putting this together. So as our first two speakers covered, and as many more of us will be covering tonight, we're in an extremely precarious situation in regards to our healthcare system and our research institutions for chronic conditions like long COVID. I'm going to go a little bit off what the prompted message was for us tonight. I would love to come to this rally and only talk about writing letters and discussing how we can sway our government as our first line of defense so that we can hope to get some more immediate or short-term relief. But with the facts as they stand right now, we don't have a functioning government. In a functioning government, we could demand recognition. We could demand our congressional representation do better for us. We could appeal to the people in charge of our systemic processes to use them to ensure that we aren't being left behind. And to be clear, I think that work is still really important. I personally continue to do that type of work when I have the energy to do it. But we're in a space where our systemic processes are actively breaking down. We have to face our reality to overcome it. And there absolutely are ways to overcome it. So don't let this reality make you feel powerless, but much of the process moving forward, I think, is going to look very different than it would for a resistance movement within a working government. Right now, getting vaccinated, advocating for clean air, and masking as much as possible are the absolute most effective tools for us to protect our immediate well-being. Advocacy within our government is still incredibly important, but for a group of people with very limited energy and an increasingly difficult quality of life, I'm of the opinion that we need to place a great focus on building community where we can, attempting to build robust mutual aid networks in whatever ways are possible and accessible for us, learning methods of resistance that have worked for other disabled people in the past. And at the end of the day, we have to ensure that our basic needs are being met to be able to get to the other side of what is increasingly looking like a complete and total fascist takeover of our government. We're in a video first media environment. So I've seen a lot of content creators recently sharing their personal stories and life experiences, particularly content creators with chronic health disabilities. And they're sharing those stories in extremely compelling ways. So if I had to boil my message tonight down to a single call to action, it would be find a way to connect to as many people as possible at a community level, whether that be a geographically based community, a social media community, a school community, a worship community, etc. And show your personal experience with your illness with as much vulnerability as feels safe and possible for you. As allies, please share our stories, actively be advocating for us in spaces where we can't be present. There are many of those spaces in this country. We're working right now to counter a message that is like literally created to confuse people and to dehumanize us. We have to push back on that in as firm a way as we possibly can. We are human beings who deserve care, empathy, love, and access. And I truly believe that no matter how horrific the circumstances seem online and in the media right now, that a massive portion of the population of this country still feels compelled to care about their fellow human beings when they can see their truth. And in a socio-political environment that has given us Trump and RFK Jr., the truth is a rare commodity. We are the sole bearers of our truth, and I hope that if we can effectively share it, we can find some understanding and support. So if anything that I've said tonight has left you wanting more information, or you're interested in the proposal to share your stories more widely, I'd love to chat with you more and talk about the ways that I've personally been doing this type of outreach and community building, as well as how I try to make my story compelling and accessible to people who may not understand what we're going through. And I hope that we can all move through the coming trials as safely as possible. And I hope that we can all find care, comfort, love, and safety on the other side of this. I would also like to acknowledge that not all of us are going to be able to stay safe here during this fight. So I do want to take a tiny moment to shout out some other work that I've been doing because it's extremely relevant to the topic at hand. If you or a loved one is interested in leaving the United States, particularly as a queer person, a disabled person, or a person of color, please visit helpmeleave.us to find more information about possible paths to residency or asylum in other countries that may be safer for you. They're an organization that started recently in Europe. It has volunteers from all around the world facilitating immigration for the safety of people in at-risk communities. Feel free to reach out to me. I'm sure Amanda can get contact information for me out there. Feel free to reach out to me if you want more information on any of what I'm talking about. Once again, that link is helpmeleave.us. And once again, thank you so much, Amanda, for organizing this and using so much of your finite energy to create a shared community space where we can organize and not feel so alone in what we're experiencing right now. Love you so much.
Thank you so much, Nathan. And you're absolutely right about community building. And that's really what we need right now. And not just caring for community, yes, but combating misinformation is another way to do that. There's so much misinformation that has been exchanged and put out there by RFK Jr., by Donald Trump, and people believe it. And so one way that we can advocate for ourselves and others is to correct misinformation out there or point people in the direction of reliable resources. So yes, that is really helpful. So our next speaker is Colleen Steckel. She is a veteran chronic illness activist. Colleen, would you mind introducing yourself?
Yeah, hi, and I will be reading. I am Colleen Steckel. I am here as a longtime myalgic encephalomyelitis patient and advocate. Thank you for inviting me to speak. I am guessing some don't know what myalgic encephalomyelitis is. I'll feel free to reach out to me to learn more. But living with ME for more than 30 years has taught me how important it is to have educated and compassionate leadership making policies that help patients. If we don't have the leadership, we're not going to get the care we need. I think an important part of No Kings is making sure every voice is heard. We must find ways to include those who are invisible because of disabling illnesses. We have too many who are invisible, and we just have to find a way to overcome that. The sad fact is Health and Human Services has ignored our voices and failed to recognize the ME disease outbreaks for decades. This failure has left patients unable to find adequate care and caused a lack of support from the community. This has led to unnecessary suffering and death. This must stop. I am seeing a similar response to the long COVID community. For me, aiming for a better future means all patients need to be adequately screened and stratified. I am seeing those with severe long COVID fall into the same abyss as those of us with severe ME. Inadequate care leaves all those under the MECFS and long COVID umbrella open to grifters selling cures that aren't based in scientific reality. I think RFK's focus on behavior modification to treat chronic illness threatens those of us who need quality medical intervention. A focus on behavior modification like diet, cognitive behavior therapy, CBT, and graded exercise therapy, GET, has caused great harm to the ME patients. This approach gives insurance companies permission to deny adequate testing and treatments. I have seen over my decades of having this illness and talking to people and advocating in public and private spaces, too many patients who had treatable and terminal illnesses overlooked because doctors slapped a label on them and then stopped testing. They refused to do further testing, and then that meant they didn't get proper diagnosis, and then they didn't get proper treatment. It's been horrifying to watch. And I'm seeing a similar approach to those with long COVID. This approach may save insurance companies money, but it leaves patients without accurate diagnosis or adequate care. It is time we have a Secretary of Health and Human Services who listens to experts and patients. I would note the roundtable that took place with the long COVID community was lacking in some real representation. To learn more about ME, I write a Substack, and it's free. If there's no charge for it, and it's called View from the Trenches of Myalgic Encephalomyelitis, and you can easily find it by Googling my name. And I'm happy to share in any way that will bring more awareness to all of these misunderstood, mislabeled conditions so that we can actually move forward to have proper care. Thank you for inviting me. I really appreciate it.
Thank you so much, Colleen. And yes, we cannot afford to have a Secretary of Health and Human Services like we have right now. Since before he even was appointed, he has been talking about battling chronic illnesses. And in theory, that sounds great. That sounds wonderful. But then comes out with policies about vaccination, which could prevent people getting chronic illnesses like long COVID and the many other illnesses that come along with it. And so you have these policies that really don't make sense and are hurting people.
And I would like to add, because you brought up that point about vaccines, ME causes immune dysfunction. I cannot tolerate vaccines. So I need that herd immunity in order to, so I am forced to be completely isolated at this time. I always mask and yeah, these aren't good policies.
That's yes. So if you're not getting, I mean, don't just get vaccinated for yourself, get vaccinated for your community as well. So that's certainly important. Our next speaker is Tania Powers, a long COVID advocate. Hi, Tania. Would you mind introducing yourself?
I'm not sure if she's, oh, there she is. Okay. Let me bring her up. She used a different link, so. Oops. There we
Hold
go.
on. Can you hear me and see me now? Hi, thank you, Amanda, and thank you, Elizabeth, and everyone who helped organize this No Kings online protest. My name, for those who don't know me, is Tania Taylor Powers. My pronouns are she, her. I have some notes in case I have some brain fog. I am a COVID conscious long hauler with ME/CFS. I was immune compromised prior to the pandemic from a mono Epstein-Barr virus infection, and then repeated long COVID infection. My second infection is what disabled me, despite taking COVID conscious precautions. Again, I want to emphasize I am part of the COVID conscious community, and I'm an intersectional advocate and activist. And for my full personal story, you can Google my name, Tania Powers, and long COVID to see my full interview with the WHN. For those who are disabled or vision impaired, my description is that I'm 5 feet small with I'm a white woman with dark curly hair, brown eyes, and glasses. I'm an anti-Zionist Jew. I'm wearing a pink shirt which says COVID-19 is airborne, clean the air, mask up. I do wear these shirts at every single medical appointment and outing that I can. And what I want to talk about is why these online events, rallies, and protests are so vital and important for our online community, for safety for everyone, and for inclusivity. These current protests that are happening all over the country and all over the world are not currently safe with Donald Trump in power, as he is unleashing the National Guard and ICE upon our citizens in America. And our citizens are exercising our constitutional rights to free speech. But even during the Biden administration, it has to be noted that these events that have been organized in protest against the government in power has not been inclusive of disabled and immune compromised people as well as caregivers. And that includes people who are both visibly and have invisible disabilities, and people who don't want to become disabled and just want to protect their health as well as their safety. So our constitutional rights started to be threatened under the Biden administration, who is also committing ableism and eugenics in addition to genocide, as is the current Trump administration 2.0. And that has become even more fascist and authoritarian than before. This is why gathering online for our health and our safety is so important, to make our voices heard. And while we still have a constitution to speak up, I do want to address that Speaker of the House, Mike Johnson, has said of these No Kings rallies and protests, he has called them hate rallies against America. It is really important to say how wrong he is. This administration labels anybody and anyone who is against fascism as their enemy. And it is because, as Americans, we love our country and we love our Constitution, that we must protect our freedom and our rights to protest, our rights to freedom of expression, and our freedom of truth from a fascist government that seeks to destroy our country from within. When I think of the beauty and the hope of the American dream, that so many of our family members fought to come here, I think specifically of the Neil Diamond song, Coming to America, or America. I urge everyone to listen to Neil Diamond's lyrics of the song America. It's truly the heartbeat of our ancestors, of our great-grandparents, our grandparents, our parents, and all of us, and dreamers all over the world looking for freedom. America was, and I still believe is, a country where anything seemed possible for life, liberty, and the pursuit of happiness. And this current administration, and the 1% specifically on both sides, are committed to trying to harm the innocent people who live here and work here. No person is illegal. The same government that practices white supremacy, colonizer Zionism in Palestine is the same genocidal psychopathic behavior that they are now doing here to disabled people. And disabled people have been saying this and warning this since the beginning of the pandemic. Now, our politicians treat disabled people is how they treat everyone. The government is currently shut down, with many thousands of Americans laid off. This was planned by Curtis Yarvin, his pen name, aka Mencius Moldbug, his writing is also known as the Dark Enlightenment or Dark MAGA. And his plan is to retire all government employees, also known as RAGE, RAGE, for retire all government employees. When I first mentioned this to people, they didn't believe me when I first mentioned this, but now people are seeing with the government shutdown what exactly is happening. With the National Guard being unleashed upon the American people, they are the only ones being paid currently by this current administration. Now, this administration and RFK ran on MAHA, yet SNAP is also being threatened. So in November, millions and millions of people, and I'm one of those millions of people who are disabled and poor American citizens who receive SNAP benefits, may possibly starve and die without access to food. Let me please remind everyone listening that this administration, including RFK Jr., are Zionists who give our tax dollars so that Israel can have free health care, while American citizens are being attacked and harmed in every single way by this administration, while our rights as American citizens are all being taken away. My previous speech from the No Kings rally in July on the at COVID Conscious Long Haulers website goes into info for people needing COVID conscious resources as well as disability justice. For the sake of time, I need to address the RFK Jr. and public health that's currently happening as far as what's being decimated. RFK Jr. is an ableist. He's pushing health supremacy and misinformation, and that is leading to lists specifically, which is eugenics. And RFK Jr. feels that disabled people are not productive to society and has publicly devalued groups of people, especially with autism, and saying that even his own son has long COVID, yet he's taken away all of the all of the resources and the research. And our worth as human beings is not dependent upon what we can physically produce under capitalism. Only collective liberation of people with mixed abilities will help all of us across all groups. So please check out the 10 Principles of Disability Justice by Sins Invalid when you do get a moment. A vision that leaves nobody behind. Disability is the largest minority group, not just in our country, but in the world. Now, regarding RFK Jr. specifically, let's get into it. We witnessed the decline with the CDC when the HIPAC HICPAC committee refused to listen to the COVID conscious community, making pleas for universal masking within healthcare. Then this year, the HIPAC committee, HICPAC committee, was eliminated. The NIOSH committee, which makes PPE as in N95 and KN95 masks, was also eliminated. Now, this administration, even more so than the previous administration, has made it very difficult for people to have a right to protect themselves in public from harmful airborne viruses. And this is why we must mandate clean indoor air quality with UL certified far UVC light, 222 nanometers, plus HEPA or MERV filters. Because this administration has limited access to vaccines, instead of overseeing safety regulations for more effective vaccines that actually prevent transmission, the CDC also disbanded the Infection Control Advisory Committee and America's Essential Hospitals. So many hospitals are going to be set to close. Lastly, despite RFK Jr.'s meeting with some of the top long COVID doctors in our country and researchers, he continues to cut long COVID clinics and funding, as well as this administration passing the big ugly bill recently, which will cut Medicare, Medicaid, and as I said, SNAP for millions of Americans. This administration isn't making anyone in America healthier again, or anybody in this country great again. This administration is specifically practicing fascism, ableism, eugenics, and genocide. And the only place they are trying to make great is Israel, while genociding Palestinians with our tax dollars. Lastly, in conclusion, those who helped RFK Jr. get into this position, which helped Trump win the election, is that RFK Jr. did town halls on TikTok with certain influencers who are now walking back some of their support for RFK Jr. specifically, as well as the administration. Now that we have finally realized RFK Jr. and Trump and many others in this administration are compromised and corrupt with their loyalties towards Israel and specifically Zionist donors such as AIPAC and Kufi, soon the people who supported RFK Jr., if not already, and this current administration will also become disabled because of the lack of mitigations for infection prevention, as well as lack of access to clinics and treatments such as monoclonal antibodies, which Donald Trump had access to as early as 2020. Please keep boycotting whenever you can, however you can. United we fly, divided we fall. I love you all. Please stay safe and mask up. Thank you for your time.
Thank you so much, Tania. That was a great message, and you touched on so many important subjects. Autism to name just one. How RFK Jr. has attacked such a large group of people, and really stigmatized a group that's already stigmatized, and not to mention spreading misinformation about vaccines causing autism and citing discredited, debunked studies. So thank you so much for bringing all that up. Our next speaker is Megan, with long COVID and also one of the co-organizers of today's rally.
Hi, thank you for introducing me. So I just want to say to start out that something that's been really interesting and fun about this so far is that like we're just hearing all these different views and stuff, and we kind of conceive this as like sort of a grassroots coalition kind of thing, because I think that in the long COVID community and in the infection associated chronic illness community spaces, a lot of the actions that people take tend to be sort of top-down driven and stuff, rather than kind of like a mass action. So I think that if we're hearing all these different viewpoints, and it's just like we're all in coalition together and we're taking actions that we agree on together, and it builds community for the next time that we need to take action together, whatever that may be. So I've had long COVID since 2023, and I'm one of the authors of our letter to the Senate Health Committee, and I'm going to explain why we wrote this letter. So over the past several months, it's been obvious from social media and conversations that there are many disabled people that don't really support RFK. Shocking, I'm sure. This includes several people with long COVID and related illnesses like ME/CFS. And this didn't necessarily change with the fact that RFK verbally committed to prioritizing long COVID when he had a confirmation hearing with the Senate. There were still a lot of people with long COVID that did not like him after that. So we wanted to give those people and our fellow disabled people who were feeling that way some organized actions to participate in that might get the notice of elected officials. We're targeting the Senate Committee on Health, Education, Labor, and Pensions. It's often abbreviated the HELP Committee, because they've done hearings specifically about long COVID in the past. They also did a hearing with Secretary Kennedy this summer about the Health and Human Services budget for the year. The top senator on the HELP Committee is Dr. Bill Cassidy from Louisiana. He's a medical doctor, and he was really key to getting RFK confirmed. But over the past few months, he started to indicate that he may be open to the idea that this was a mistake. So that's why we're targeting that specific committee. Something happened a few weeks to months ago that really kicked this off, which was that RFK held a roundtable discussion about long COVID. This sort of demonstrated that he wants our specific community to support him, and he wants to be able to say that we support him. From my perspective, it was really hard to take anything said at that roundtable in good faith, because this isn't a secretary of HHS that has a proven track record of doing good science. He and his allies also said a bunch of things against the idea of government-funded basic research, which is one of the things we still need a lot for long COVID. When you have groups of your fellow disabled people, like the Autistic Self-Advocacy Network, speaking out about how someone has harmed their community, and leading organizations of doctors across specialties suing that person over their unscientific policies, you have to look at that the bigger picture. You can't just focus on how the situation might benefit you and research into your disease alone. So even in spite of that roundtable event, we're calling on the Senate Health Committee to ask for Secretary Kennedy's resignation. They don't have official power to remove him from HHS, but the committee, and especially Senator Cassidy, calling for this would be powerful and would demonstrate that this administration is not totally above being accountable to the American people. We're also asking for the members of the Help Committee to pledge to confirm someone new that does have that proven track record of excellence in science. Among other things, we want that person to rehire all of the workers at HHS agencies who were fired by Elon Musk and Doge this year, and that includes people from the National Institutes of Health. And I do want to say, like, this is a reach. This is a long shot. It's not that we're not gonna sign one petition and they're gonna just do what we're saying. It's the fact that we can all picture ourselves as that final grain of rice that tips the scale. So I do want to acknowledge that there is some tension here between the strong support of federal scientists and some of the issues that our community has had with the NIH in the past. The long COVID community and people with other illnesses like ME, CFS have definitely had their problems with the NIH, or rather they have been a problem for us, both individuals and the institution. So there's definitely a history here. One of the articles linked in our letter gets into some of the recent issues that the long COVID community has had with the NIH, so I would definitely recommend reading that. That's where we're also asking that the committee really emphasize that a new person would need to work with our community to avoid previous mistakes. We don't need any more high-ranking NIH officials assigned to long COVID or related illnesses that believe it's a psychological illness instead of a biological illness that we just don't understand well enough yet. But coming in and illegally firing scientific research workers isn't accountability in any way, and it isn't accountability to our community. It's just chaotic destruction, and it has harmed people with other illnesses. We don't want people with cancer and diabetes to be in the situation that we're in, where research is underfunded. We need progress on all of these diseases, and we need to have the same high standards for long COVID research as we do for research into diseases where there's been more progress at this time. So we're asking everyone who wants to take further action after attending this rally to sign our letter if you agree. If you scan the QR code that you're seeing on your screen, you'll be taken to a Google form that you can use to add your signature that also links to the text so you can read it. We're trying to collect signatures from as many individuals and organizations as we can. I do want to emphasize that this is meant to be a public action and people's names will appear publicly on this letter. So it's totally fine, totally welcome if you want to just sign your initials, if you want to just sign your first name, that's all perfectly welcome. And it would also really help if your senator is one of the ones listed, if they're on the help committee, if you would send their office an email linking our letter and letting them know that you signed it and why. You can also bring this up with organizations that you're part of or that you support, especially disability or chronic illness related organizations, but other groups like local indivisible chapters or labor unions, really any group that you're connected to are also very welcome. Thank you so much.
Thank you, Megan. And even if you wouldn't be able to sign the letter, give it a read. Megan has done a great job of putting information together and sending a message to the relevant senators. Our next speaker is Renee Semarge, a public health educator who also has long COVID. Renee, would you mind introducing yourself? Renee, are you here?
Yeah, she's here.
Oh, great.
Oops, I just muted her. I'm
Sorry
sorry
about that. I was having a couple of technical problems. Thank you very much for the opportunity to speak here today. A little bit of an introduction. I come from a decades-long career in public health. I also taught epidemiology and health sciences at a local branch of our state university system until 2 years ago when, unfortunately, long COVID and the myalgic encephalomyelitis, more commonly known as CFS, took me out of the game. So that's why I'm speaking to you today from bed with my background of some flowers that I got a while ago. But I want to talk really quickly about what public health actually is. I think most people don't know. To the majority of Americans, public health is the group of folks that shut down restaurants, that give people birth control, and are meanies and tell you that you need to stay home or to wear a mask. That's how people see it. Public health is much more than that. Public health is based on primarily prevention of disease, to stop people from becoming sick in the first place. If that fails, A second part of public health is what's called secondary prevention or early detection of a disease. That means getting or the opportunity to get people into treatment when a disease is easier to treat or cure, and the opportunity to stop them from spreading a communicable disease. Next, public health works to reduce suffering and improve quality of life for people living with chronic conditions like long COVID. The core science of public health is epidemiology, which relies on public health surveillance. That's just reporting of certain communicable diseases and more recently, chronic diseases. Into this, like a wrecking ball, that's 2015, Miley Cyrus, came RFK Jr., and it's time for a little bit of history on this guy. RFK Jr. started out back in the 1990s, beyond being a famous Nepo baby, as an environmental activist. So he kind of made his bones that way. But he was also a very early adopter of anti-vax and anti-science sentiment and misinformation. And he does it and has done it in a really tricky way. He will put together graphs or have his people put together things that look like they're science, but they aren't. And as a country, we have a great deal of scientific illiteracy. And frankly, a lot of the time when people hear things like statistics and science, their brains kind of close like vises and nothing else is getting in there. And he's really good at setting that up, at setting up things that look like they're science. People glance at them and they think, okay, I've got that. And they think they don't need to learn anything else about whatever it is. Okay. Back in 2015, he started a group called the Children's Health Defense Fund, or Children's Health Defense That Did Anything But. It's an anti-vax group that also was against water fluoridation and oddly acetaminophen, also known as Tylenol, which might ring a few bells for us more recently. At the time, he falsely said that vaccines led to autism, blaming thimerosal, which has not been commonly in use since at least the 1990s. So it's an ingredient that's no longer in vaccines anyway. Interestingly, RFK Jr. himself has a history of mercury poisoning. Then came Samoa. Back in 2019, there was a problem with administration of some vaccines in Samoa. They were given concomitantly with muscle relaxants, made it so they didn't work properly. RFK Jr., along with other anti-vaxxers in Samoa, encouraged people to forgo vaccinations for their children. It led to a very large outbreak. That in turn led to more than 80 deaths that could have been prevented with a simple shot. This, of course, brings to mind our current measles outbreaks here in the United States, which are coming or bringing our 33 years designated clear of measles to an end. That's coming to an end after January. All right. When you get to the heart of RFK Jr., it's hard to say his name. You guys mind if I call him Junior? Is that okay? Okay. So part of Junior's shtick is his belief in miasma theory instead of germ theory. Miasma theory, in his way of thinking, now it's not classical miasma theory. I used to teach history as part of epidemiology. Okay. He believes that health is entirely dependent on environmental exposures and diet. Now, he's not wrong that those things affect immunity. What he is wrong about is that germs matter. Germs are what causes infectious disease. You will not get an infectious disease without a germ present. Now, he's got some contradictory beliefs about infectious diseases, including COVID and long COVID. One of them is the belief that Lyme disease is, I'm trying to find my quote here. Give somebody with ADHD a couple of days to write a presentation without some practice for a while, and they'll write you a novel on 5 pages of a really big notebook. Lyme disease is a military weapon developed in Plum Island. He said that in a podcast back in 2024. He also believes that COVID-19 is targeted to attack Caucasians and Black people. The people who are most immune are Ashkenazi Jews and Chinese. And that's a quote from a statement that he gave in July of 2023. So in spite of not actually believing in germ theory, there are some stuff that he's got in there that are based on racism and conspiracy theories. All right. Sorry about the sigh. Y'all, it's just that there is a lot here, and I'm checking my time because, frankly, I could go all day. All right. He did campaign with both of last year's presidential candidates for a position in Health and Human Services. And because we live in perhaps the stupidest timeline, he is our current head of Health and Human Services. In that role, he promised to address chronic diseases with a focus on long COVID in particular. And I'm skipping over a lot about COVID so that I can focus on long COVID. He said that he would dedicate $1.5 billion to the National Institutes of Health for long COVID research, but instead he gave nothing, not a thing, just crickets. He's met with long COVID advocates, and afterwards, more crickets. What he did do was to fire everybody who was on the advisory committee for immunization practices. That's the group that offers advice on vaccines to top public health agencies and health insurers, and replace them with vaccine skeptics, people without medical vaccine or without medical backgrounds. Basically his besties, and made vaccine access really confusing. As of this month, there is no sign off on recommendations for updated COVID vaccine availability for people who are low income. For low-income kids, and this means that states are unable to order vaccine or COVID vaccine shots for kids who are covered by the Vaccines for Children's program, and that is around half of all United States children. Bopping back over to long COVID. Long COVID is the most common childhood illness in the United States. It puts asthma in its rearview mirror. That's what we're dealing with a regime that is so anti-science that it took down the federal resources data on long COVID and children's long COVID. Do you guys remember an old Rage Against the Machine lyrics? They don't gotta burn the books, they just remove them. Removing government data from public health surveillance from the internet, I would say, is about the same thing as getting rid of books. RFK Jr. has said, or Junebug as I'll call him, has said that he is committed to continuing research, but instead NIH research has been eliminated, and the scientists who are committed to performing that research are increasingly looking for homes elsewhere. Back in Sorry, guys. It's a lot. Don't know if I mentioned that I am living with moderate to severe ME/CFS, and woo, this stuff hits me kind of hard, but I'm gonna do it. Jamie Seltzer, the scientific director of Millions Missing, said back in May that there is a campaign of revenge against infectious disease, public health, and infection-associated chronic conditions because of the COVID-19 pandemic. And there's no way that I can disagree with that. That was back in the Sick Times, published, I believe, in earlier this year. All right. We're working against a lot, including somebody who's in charge of public health for a nation who does not believe in the central tenets of public health. So what can we do about it? All right, we've got some stuff on our side. We got the truth on our side. Truth wants to be told. Information wants to be free. We've got our stories on our side. Now, one of the things that I used to teach my students was that it's not enough to know a statistic or to know how a scientific process works. If you can't explain it in ordinary language to somebody who doesn't have any background in your field of study, then you don't really understand it. You have to be able to tell a story because people are built to want to listen to stories. And when we learn a story and it means something to us, we want to spread those stories. That's what we have. We also have that all of those people who are working in public health is more than a job to us, because I'm one of those public health people. It's a calling. Everybody who was for public health still is. And something else that we've got is always, always, always hope. Fascism hates hope. Cling to it with everything you have. Thank you so much for letting me speak today. Sorry for going on so long. Glad to be here, though.
Thank you so much. That was wonderful. And you covered so many important topics. And thank you for the history of what this guy's been up to. Yeah, not a lot of good. Amanda, did you have some?
Oh no, I was just glad that Renee could make it because we weren't sure even yesterday if she could. So.
Oh my goodness. Well, thank you. I'm so glad you got to come. Our next speaker is Crystal Robinson, who has long COVID. And Crystal, would you mind introducing yourself?
Yes, my name is Crystal Robinson. My pronouns are she, her. I live in Illinois, and I've had long COVID since March 2020. I'm mostly housebound, occasionally bedridden. I was much more frequently wouldn't that be nice? Bedridden in 2020 and 2021, but luckily I've seen some improvement. But the only reason why I can participate in a protest is because of Amanda, Elizabeth, and Megan setting this up. So first of all, I want to express how grateful I am. There's been a lot of great talk about science, and it is so important. But I got my degree in English, and I think language and how we talk and how misinformation is conveyed is an important part of understanding what is happening and how we can combat it. So, RFK Jr. We've seen a lot of questionable public health since 2020, but RFK Jr. takes the cake. He is just a font of misinformation. I could talk, well, there's more information for him to talk about than I think we have energy combined to get through in a single day. So what I want to do is try and distill the main themes of that misinformation and how it works. So this misinformation is propaganda. And the way propaganda works isn't necessarily that people buy into it hook, line, and sinker. There are people who do. There are people who believe everything he says. But the real impact is nudging people off track just a little bit. And being 1 degree off when you go a mile can be a lot. And the further off track you get, the further distanced we get from each other and true solidarity. So we've heard some of this misinformation and propaganda from RFK Jr.'s wretched coterie of ghouls for a while. People like Mohammed Oz, like Jay Bhattacharya, like Vinay Prasad, making all of us less safe. And the first thing I want to talk about is health is solely an individual responsibility. Now, we all know that's not true, but the way this kind of language works is it removes other aspects of concern. It makes us look inward and become kind of self-focused on what we can do to protect ourselves. And you see this in a lot of social media, like health influencers, people focusing deeply on their macros, how often they exercise, and even within social media of COVID conscious people, wearing a mask, bringing an air purifier with them. Yes, that's important, but that is not public health. That is not his position. And he's abdicating responsibility by pushing it onto us. And that brings me to my next point, which is if individuals are solely responsible, then there are no victims. And if there are no victims, there are no perpetrators. And we know that this administration has killed people. Excuse me. From the gutting of USAID to the demolishing of the public health supports that we rely on, to tearing apart proven effective interventions like the childhood vaccine schedule. They're setting us up for there to be hurt or worse and saying that it's our own fault. And even beyond that, this kind of mentality means that private companies that can make a profit get to benefit, and it doesn't matter who they hurt because individuals are responsible. There's no victims. So that means they can poison our water and poison our air and have unsafe working conditions for vulnerable workers. And it's not their fault. And that's obscene. And that brings me to the last theme I want to talk about, which is the idea of this responsibility. So there are healthy, responsible individuals, and then there are undisciplined, disabled, or chronically ill individuals like me. And by creating linguistically two separate groups, and this can always shift for whatever's convenient, but there's a group of people who can be cared about and invested in, and then there's an other. And this country, we love it. It has a long history of othering people, of indigenous people, Black people, of immigrants, of disabled people. And whenever it's convenient, These people become those people, undisciplined others that can be abandoned. Now, RFK Jr. says that he wants to address long COVID. Now, I don't know about other people here, but I don't want that man's attention in any way, shape, or form. He turned everything to ashes and blah, blah. But so he says he wants to address it. But let's look at his actions. What he's done is defunded research, defunded or gutted different government organizations that, while imperfect, we have relied on to be a source of action. And while it's true that we don't know a lot about long COVID, there are some things we do know. We do know that vaccination, even if it doesn't prevent infection, can help prevent long COVID. And we do know the best way to prevent long COVID is to prevent COVID infection. And this is a man who does not believe in any of it. So ideally, RFK Jr. gets removed from his position at HHS. In an even more ideal situation, he was never installed. But what can we do, knowing what we do, about how RFK Jr. and his ilk talk about health? So first of all, we often don't have the choice except to look inward and think about how we can protect ourselves. We need to think bigger than ourselves. We need to talk bigger than ourselves. We can't just say, well, I mask. Well, I got my vaccine. I'm safe. That's not good enough. And there are people like Colleen who do not have that option. And another thing we need to be watchful of, something I've seen on social media, even amongst COVID cautious folk, is being careful about thinking about different groups as those people. And often we are frustrated by behaviors like people not masking, people not advocating for clean air, people saying COVID is over. And yet those people are still us. They're part of our communities. And they're people like us who deserve robust, scientifically supported public health. And until we can get RFK Jr. packing his bags and, I don't know, in a desert island where he can't hurt anybody anymore, we need to support each other. And by doing things like this, where we come together and, support our spirits. And one thing I do want to say is, it was the long COVID community that helped me when I first got sick. Thinking of what RFK Jr. says about being healthy and not being subject to illness, I called the hotline for my town, and the doctor said, "You're young and healthy. You don't have anything to worry about." I used to be a gym rat, and I couldn't go up a flight of stairs. I could never get enough sleep, and I didn't know what was happening to me. And it was through this community I was able to get an idea of what I was up against, what kind of treatments might be available, comorbid conditions like POTS, mast cell activation syndrome, that did have treatment programs, the emotional support, and of course, learning with people who have been sick a long time, often people with ME/CFS, how you can manage to be very sick and still fight back. Thank you so much for your time. I really appreciate it. And yeah, no kings, down with RFK Jr.
Thank you so much, Crystal. I loved hearing the English perspective on things and how important language is. And it really is. Moving on to our next speaker, and if speakers could keep it to their allotted time, we're hoping to finish at 7. It is Meredith Moffett-Hurst. Meredith, please take the floor.
Thank you so much. I, like Tanya, have a long COVID shirt on today. My shirt states, long COVID is a queer issue, a race issue, a disability issue, a woman's issue, a labor issue, a trans issue, a human issue. That's why I'm here today. My name is Meredith Moffett-Hurst. My pronouns are she, her. I am from Wilmington, Delaware. Before 2020, I was healthy. However, after my first infection, I was left disabled. I was in the legal field for 15 plus years, but had to give up my career due to being disabled. Now, as a disabled single mom of 2 children with no income, I rely on state benefits such as Medicaid and SNAP to provide the basic needs for my family. Medicaid also provides me with long-term care, which includes my daily aid to assist with everyday living. Without these basic needs, my family would greatly suffer. All of us have asthma, and without access to the medication that Medicaid provides, we would all be hospitalized, with my son and me in the ICU on BiPAP at least. The hospital is a very dangerous place for me due to all my medical conditions resulting from long COVID that make me immunocompromised. Without Medicaid, my life, sorry, I just messed up my, where I was. I am so sorry. Without Medicaid, my life and my children's may end. This is a basic need that I am relying on the government to assist with, in which this administration is threatening on so many levels with funding cuts, firings, misinformation, and legislation. I saw many comments that our LC community shouldn't be political. Healthcare is political. Without our community speaking up, we will disappear, which RFK Jr. and this administration are trying to do. Remember, our government works for us. Reach out to your legislators. It's time to take our government back. No kings. And I'd like to end it with a quote. Know that suffering in itself is horrible. It's meaningless. But when you can attach a purpose to your pain, you can transmute it into wisdom and a new reason for being. And that's from Ryan Pryor. Thank you.
Thank you so much, Meredith. It was really great to hear your story. I mean, unfortunate to hear your story, but thank you for sharing it. Our next speaker is Effie Seiberg. She is a writer with ME/CFS. Effie.
Hi, everybody. Thank you so much for having me. My pronouns are she, her, and I am a white woman with dark curly hair and as yellow a scarf as I managed to find. We're hearing a lot of really depressing things today, and I'm a satirist, so my coping mechanism is to laugh at them. And so I wrote a satire for all of you. This is called Mission Report from the Tiny Alien Piloting RFK Jr.'s Body. Mission Report 892, Project Destroy Humanity V2, RFK Jr. To Kelvin Central Control, Planet Kelvin D. I am blending in beautifully with the humans. They have no idea that their Health and Human Services Secretary is a meat suit piloted from within from a being from Planet Kelvin D. The body is working well, other than the voice box, for which I have filed a repair ticket. To better appear human, I have employed such techniques as working out while wearing jeans and swimming in sewage-polluted waters, standard human activities. I was pleasantly surprised to see that the character background created by the advanced team, including has sawed off the head of a beached whale and has strategically positioned dead bear cub in park, have worked so well. Humanity is loving the dead animal stories. Please send my particular thanks to whoever came up with has dead worm in brain, as I can use that if I'm discovered. For credibility, I'm also ensuring that Secretary Kennedy shows off his knowledge via the research that humans seem to find most compelling, which is a combination of TikTok videos and someone on ketamine said so at a party. On to the substantive work. In the guise of Secretary Kennedy, I have convinced the humans to slash medical research across the board, and I'm working on reducing medical care, called Medicare and Medicaid, as well. I've also eliminated an enormous percentage of Center for Disease Control jobs, including many of those investigating outbreaks and managing infectious disease responses. What's most encouraging, however, is the progress on fomenting fear of vaccines. Our test case with measles has shown success, leading to the biggest US outbreak in 30 years. Undermining the COVID vaccine has gone a little less well, as outcry forced us to walk back booster restrictions, but the good news is that in the confusion, vaccination rates went down anyway. To make sure we also hit the next generation, next up are the MMR and hepatitis B vaccines for newborns. Repeating the model of increased vaccine fear, plus reduced vaccine research, will be useful during the next pandemic we create, as I know the last one did not do the trick. I was delighted to find that these anti-health steps were celebrated and did not cause the backlash I expected. I'm particularly grateful for all the eugenicists around here, as their letter rip philosophy of disease management will be enormously helpful. As referenced in my last report, we have now completely scrapped the plan to concentrate on foodborne illness. While reducing staff for food safety inspections has been great for disease, unfortunately, fewer US foods are being bought internationally due to tariffs. As such, it looks like highly contagious infectious diseases are still the most effective strategy for Project Destroy Humanity V2. The Kennedy meat suit, will make a fantastic patient zero, as I've surrounded myself with anti-vaxxers who'd rather die than mask. Since Earthians seem strangely fine with reversing over a century of their own scientific progress, I propose these next steps. First, we get rid of hand washing. I've already convinced Secretary of War Hegseth that germs aren't real because you can't see them. Then we can follow up with a combination of plague rats, typhoid parties, and a return to open sewers. Next mission report will be in 1 Earth week. Signing off, Captain Mandelbrot Vortexian, field agent piloting the RFK Jr. suit, Washington, D.C., planet Earth. P.S. I know field missions are kept separate for a reason, but I do have to ask, is Trump one of us? If so, the agent piloting that meat suit is doing admirably, but coordinating plans would make Project Destroy Humanity V2 go much faster. Thank you so much. No kings. Please sign the petition and please call your elected reps.
Thank you so much, Effie. That was a much needed laugh. After, yes, a lot of depressing stories, I cackled out loud alone in my apartment when you mentioned working out in jeans. It's a great thing.
All the data points in there are true.
Right. Yeah, that's the scary part. So our next speaker is Dom Kelly, the CEO of Disabled South. Dom.
Hey everyone, my name is Dom Kelly. Hi Amanda. I'm the founder and CEO of New Disabled South. I'm based in Atlanta, Georgia, and yeah, what an honor to get to be here with y'all and hear from everybody who has just said everything that we need in this moment. The realities that we need to ground ourselves in, and in the interest of time, I feel like I don't have much to add because we all know about this moment that we're in. We know what's happening, and I hope that we know that this is for so many people who are at the highest levels of power, RFK Jr. himself included. They know exactly what they're doing. A lot of the things that they say and do, they don't necessarily believe to be true. They won't invest in clean air, but you know that they have some of the best COVID mitigation that money can buy. So many of these people with the highest levels of wealth and power have the best COVID mitigation that money can buy. These are people who have their entire goal is to feed lies to people, so that they can hold on to what their number one goal is, which is a white supremacy and Christian nationalism. They know that they are losing the majority, that white men will not be the majority very, very soon. And they are doing everything they can to hold on to that power. There's so much right now that it scares me, that makes me lose sleep at night, and there's a lot that still gives me so much hope. One thing I'll say is back in March or April, my 2-year-old daughter got measles. We are a COVID conscious family. We mask. We taught our daughter to wear a mask, and she had a fall. We brought her to the children's urgent care in her mask with her bloody nose and mouth, and you know, they had to take her mask off to fix her face, and she got measles, and she was half vaccinated. She did not have her second shot because she was too young, and she got it, and it was the scariest couple weeks of my life so far, and I was so angry that we are here in this moment when measles was eradicated 25 years ago. And then today I read that in Spartanburg, South Carolina, 120 children right now are quarantined because of a measles outbreak. There are just no words. It's devastating, it's terrifying, and I feel hope today because I get to be here with all of you, with 200 people who know the truth, who know what is happening in this country, in this world, who know what it's like to be gaslit, because we've been gaslit for the last 6 years. I think it's important to recognize that so much of what is happening right now, the stage for this has been set by Democrats as well as Republicans. Democrats declared an end to the global pandemic, or the pandemic in this country at the very least, and we knew that not to be true. And I think what gives me the most hope is that I see people caring for each other. I see care webs and mutual aid networks, folks who make sure that their neighbors, if they've lost their health care, can still make sure that they get help at home, taking their medication, bathing themselves, getting food to their door, picking up their kids, all the things that we do in community. You know, I see thousands and thousands, millions probably, of people today who did what they could to take action, and whether or not there was a direct action or target or demand tied to the rallies across the country today, people got out there and used their voices, and we have to keep demanding that we are given the platform to be able to do this for folks who can't get out and go in the streets and go to a rally. it's beyond frustrating that anybody has to fight to have a No Kings rally on Zoom for people who can't be there. That's exactly. I didn't want to. I wasn't sure if it was a secret or not, Amanda. But all right, yeah. I mean, the organizers, Amanda, and everyone else should not have had to fight the folks, the organizers who didn't want these to be on Zoom when there are so many people in this country who cannot go out and take those actions in public today. But it gives me hope that Amanda gets to, you get to use your voice and stay firm in the principles of disability justice, to remind people who forget about those of us who are disabled, to remind them that they can't be free unless we're all free. And that's why we're here. So I'm honored. I'm honored to get to hear y'all. I really want to invite everybody to find your political home. And I don't mean political party. Find your political home. I've had a lot of political homes over the years. Jewish Voice for Peace, Movement for Black Lives, and go down a list of political homes I've had. And what we were trying to do at New Disabled South is build a political home for disabled folks in the South. And I think right in this moment, this feels like my political home with all of you, folks who get it, folks who are out here doing what I think is right now the hardest work, to educate people about what's floating around in the air around us, how it can harm them. Very last thing I'll say, I'm a doctoral student, on the side, getting a doctorate in public health, and I got to be with my cohort of classmates, and a speaker from the Trump administration was invited to speak to us, and everyone was noticeably furious because none of us knew this was happening. And she praised RFK, she praised her best friend Pam Bondi, and just on and on about all these people who are doing so much harm. And I say this not to pat myself on the back, but to ask all of us to find the courage to speak truth to power. And in that moment, when they asked for questions, I think there was a reason why they waited for me to. They told me I had to ask the question last and asked me to shorten my question because they knew that I don't give a shit. But I got to, and she's a medical doctor, pediatrician, high level in the administration, and I got to say exactly what I wanted to say to her face, and I hope that we all can continue to do that, because they can try to silence us, but there are a lot more of us than there are of them. So thank you all for being here. It's an honor, and no kinks.
Thank you so much, Dom. I love the idea of having a political home. And as you were saying that, I was thinking through some of the ones I've had in the past. And yeah, I think that's such a powerful concept. Our last speaker is one of today's co-organizers. It is Amanda Finley. She is a former archaeologist and federal employee and a tireless long COVID advocate. Amanda.
Thank you so much, Elizabeth. And thank you for being here for us today. I really appreciate it. Let's see, is my screen is still showing you. Hold on. As much as I love you. Here we go. So I'm going to tell you a bit of a story as part of this today. Here we go. Mommy, you're so brave. You're not afraid of anything, my son once said. And I said, no, buddy. Brave is when you're afraid, but you do it anyway. And my mind traveled back to the summer of 1997 at a time when I was very afraid. I was 20 years old, and my family lived in western Kansas, a few miles east of the Colorado border on the vast high plains. Author Dayton Duncan once said it was a place where the wind blows and does at will with you what it pleases. Unlike the Ozark Hills where I grew up, it's a place of tumbleweed and cacti, prairie dogs, and antelope. It's an unending sky that leaves you vulnerable and insignificant. It's also a place of hot summer days cooled down by powerful storms. My dad is a hospital and nursing home administrator, and he had started a new job about 90 miles away from Johnson, Kansas, in this little bitty town called Leota. Of all the places we've lived, our house outside there is one of the most homesick. It's the place I'm most homesick for in this moment. But in 1997, it was a fresh start. At the end of his first week, my dad had no sooner walked in the door after the long drive back home when the phone rang. It was the office manager at the hospital, distraught because the clinic receptionist quit at the last minute and they had no one for Monday morning. And in a town of 1,000 people, it's even harder to find someone on short notice. My dad, however, had a solution. He informed the office manager that he had someone and they would be there at 8 a.m. sharp on Monday. It was me. I was home over the summer from Truman State University, where I was a music major. I also worked in medical records at the hospital there, and I had volunteered at my dad's hospital often. Or I was volunteered. I suppose it was more conscription, like you'd see in an old cartoon where the sea captain comes and breaks a bottle over someone's head and they wake up and they're typing medical reports and filing insurance. A week later, my dad and I headed back home, and it had been a long day. We had a lengthy drive through some of the least populous areas of Western Kansas. I volunteered to take the wheel so my dad could get some paperwork done. As we headed out, a beautiful cumulonimbus cloud billowed overhead, but it grew quickly into a more menacing situation. Now, my dad, who was also a weather spotter for the National Weather Service, put his paperwork down and started eyeballing the storm. As we drove south, a heavy band of rain just missed us, followed by a shield of hail. And if you know anything about storms, you know that when things stop coming down, that's not a good sign. The black cloud above us was swirling in very discomforting ways. And not peeling his eyes from the window, my dad said, "You can drive a little faster if you want." He never drove his 1982 Buick Regal more than 55 miles an hour, but I replied, "Dad, I've got it floored." We managed to make it safely to the next town and eventually home, but it was a really scary experience. My dad taught me to be cool under pressure, and that lesson has served me well. The last 5 years of COVID have been among the scariest. And looking back, I often wonder how I made it. How did I survive that first infection? It was the sickest I'd ever been. Losing my home as a result of it and winding up living in a tent in the woods, my otherwise steel-trap memory has blanks from this time. One of my long haulers in a support group I started died during that time, and I was terrified I would be next. But it wasn't some miraculous protection that spared me. It was my community. The very village I built as a long COVID community was there to sustain me through the unthinkable, and I was prepared to fight for them. Until a few years ago, I wasn't interested in politics. I hated politics. Subconsciously, I think it was because some of my views were indefensible, and I didn't want to address that because that required discomfort. I also didn't think one voice mattered. How could it in a screaming sea of opposing views? I remember not wanting to vote in the presidential election one year. I talked myself into it at the last minute, however, by remembering that it was in my great-grandmother's lifetime that women were allowed to vote at all. And one great-grandmother never had that right until the very end of her life because she was Cherokee. So off to the polls I went, albeit half-heartedly. But in September 2018, my thoughts shifted. Well into the Trump presidency, the Senate held hearings for a Supreme Court vacancy for Brett Kavanaugh. It was more than a confirmation hearing, though. It became an informal public referendum on sexual assault. The horrors of everyone hashtagging Me Too were forced into the limelight. And two brave women spoke for many of us. Anna Maria Archilla and Maria Gallagher accosted Senator Jeff Flake at an elevator. They demanded his attention, logic, and decency. They laid bare their lived experiences and refused to allow him to look and hear past them. It was fierce. And in that moment, I realized one voice can matter. At the end of the day, Kavanaugh was still confirmed, but their example paved a new neural network in my brain, a bold assertion of the power all of us have innately. When I was homeless and alone with long COVID in a tent, I thought often of these women, and I thought of someone who inspired me in my childhood, a teacher, Mary McKinley. She taught me the power of knowing what tools you have and how to wield them. And the tool I had in my tent was my cell phone. I spent my evenings charging devices and power banks at a bathhouse at Weston Bend State Park. And all day, every day, I forged connections, focusing on finding the thing I could do, squash the fears and what I couldn't do. I went from thinking, no one's ever going to see any of this, to thousands of people seeing all of this. In over 700 video messages scattered across Twitter, I demanded more. My friend was dead from long COVID and he shouldn't be. And I told people, I want you to look at my face. You listen to the words I'm saying. He's dead and he shouldn't be. The universe has a funny way of listening sometimes. And one evening, I got a message. It was from actress Morgan Fairchild. I saw your post about your friend. I'm so sorry. Are you okay? No, I'm not. How are you? And Morgan wasn't the only one. I almost fell over the day Representative Ayanna Pressley followed me. She did more than pleasantries and clicks, though. She truly listened. And late one evening on a night I was particularly tired and unwell, I had a gut feeling. I thought, if she were to call tomorrow, what 3 things would I tell her? And I wrote those 3 things down. She called the next morning, and those 3 things are now in the Treat Long COVID Act, of which she co-sponsors. But now we face a new threat, our own government. Over 400 million people globally are struggling with long COVID, and we've watched in horror as research funding has been gutted, restored, and gutted again. The very tenets of public health that have kept us all safer have been shredded. All we have fought for in the last nearly 6 years is at risk of being lost. Given the magnitude of the reality, it's understandable to ask, what can we do? Where do we start? We start by being here today. We start by listening to the voices of the people most adversely affected by this destruction. We acknowledge the privilege and comfort that open the door for authoritarianism. We get uncomfortable and we get loud. We demand better. We need to demand better, which is exactly what we're doing here today. I encourage each of you to read and sign our letter to FRFK and restore the science and sense in our medical institutions. I also encourage each of you to keep hounding your Congress members relentlessly and vote at every election, up and down the ballot. Know what's on your ballot. Know the people running, like Hartzell, and the issues at stake. Hell, run for office yourself. But most importantly, support your neighbors. We're facing unprecedented challenges. In 2 weeks, if the government shutdown hasn't ended, millions of people across the United States will go without food as EBT will not have funding. Don't be blind to the need. Don't look past it because it makes you uncomfortable. Look it in the eyes and take action. No kings also means standing up for public health and safety, standing up for science and peer review, for evidence-based practices. It does not mean eviscerating the very institutions that keep us safe. And it most definitely does not mean cutting funding for research. It's remembering those left behind with debilitating chronic illness caused by a virus that this administration and his previous reign of terror failed to address. I eventually made it out of the tent, as you can see. I'm now housed. My job situation at the IRS was scary, but that's over. But I've done more than just learn the lesson of acting despite fear. I've lived it. And each of you has the power to do the same. Our world is very dark, but you, each of you, are a light. You might not be able to see it, but others do. I will love the light, for it shows me the way, yet I will endure the darkness, for it shows me the stars. Lean into each other, into your strengths, and into the knowledge that you can do this. As we learned after my hometown was devastated by a tornado in 2011, there's no rebuilding. It's just building in a new reality. And that's exactly what we'll need to do here. And this is our time. This is our country. This is our opportunity to show the world that we are founded on the principles that life, liberty, and the pursuit of happiness are inextricably grounded in diversity and freedom. This is our time to be a light in an ever-darkening world. And in the words of Sarah Williams, I have loved the stars too fondly to be fearful of the night. Thank you so much, everyone, for being here.
Thank you so much, Amanda. I can't think of a better way to conclude today. So thank you everyone so much for coming. This was wonderful to see everybody turn out and hear all the speakers. No kings, no RFK Jr. I'm glad we got to participate from afar. Thank you again.
Thank you, Elizabeth. Thank you everyone for being here. You can find the recording on YouTube. It'll be at youtube.com/@COVID long hollers.
Great. Thank you.